Are you ready to get started?
I didn't know if we were going to still do our signature line.
Yeah. Yeah, we're doing our first ever Minisode.
It's little.
It's baby. It's so tiny.
So we're just going to jump into these mini-sodes for you guys. Today we're going to talk about Dr. Helen Rodriguez Trias. She is mentioned in our previous episode about the work she's done on behalf of women, marginalized communities. She's just an activist, and we love that. So jumping right in, she was born in 1929 in New York City to two Puerto Rican parents, but her family moved back to Puerto Rico when she was very young, and they stayed there until she was 10. Her mother was a teacher in Puerto Rico and was an activist herself, so she was focused on the right to teach in Spanish since the Puerto Rican education system was one that imposed that you teach in English or like was very Americanized.
Oh, that's interesting. Yeah. She was an activist from the start, raised by a strong female lead, which we love.
We do love that. Fun fact about her mom is that she was a teacher in Puerto Rico, but whenever they moved back to New York, she wasn't allowed to teach there. They wouldn't give her credentials.
Why?
And I guess the certification in Puerto Rico wasn't enough.
Mm.
hmm Helen was a gifted student who loved science and people. And when she was in the New York school system, she was at first placed in classes with students who were considered poor students, even though she was really advanced. Another teacher noticed her and placed her in the gifted and advanced classes, and then she took off. Because when she moved back when she was 10, she couldn't speak English, but she
Mhm.
learned it really quickly.
Yeah. Sometimes
Um,
that's all it takes is like one teacher to
you're
recognize your
right.
potential.
That's just a fact. When her family was in New York, she and her mother discussed that her dreams of studying medicine were better achieved in Puerto Rico with their scholarship system. So Helen chose to study at the University of Puerto Rico in San Juan. An activist from the start, she became involved with the Puerto Rican Nationalist Party and she participated in student strikes. Unfortunately, her brother, who was assisting her with her college expenses, said if she was in a political movement, he would not help her.
Oh.
But yeah, gotta sometimes listen to the money, I guess. So she ended up leaving school, went back to New York, got married, had three children, and then went back 7 years later to Puerto Rico to finish her degree.
Wow, that's
Yeah,
impressive.
she's like, I still have dreams. You're not gonna stop me from your societal
Good for
influences.
her.
Yeah, she actually got her medical degree at University of Puerto Rico School of Medicine at the age of 31, the same year she gave birth to her fourth child.
Oh my gosh.
Yeah, imagine. So by that time, she had already had over a decade's worth of experience as an organizer. So she had like already has a long resume, and now she's a doctor,
And has 4
and she
kids.
has four kids. Right?
More power to you.
Can't imagine. During her residency at the University Hospital in San Juan, she established the first center for the care of newborn babies in Puerto Rico. And after that, the hospital's deaths of newborns decreased 50% within 3 years.
Wow.
Yeah. She began her practice in pediatrics, divorced her husband, and moved back to New York.
You just gotta take care of yourself. Do
Sometimes,
what you
yeah,
gotta
do what
do.
you need for sure. She became the head of the Department of Pediatrics at Lincoln Hospital, where she worked to give workers a voice and advocated for the needs of the Puerto Rican community. There were a lot of new doctors at that time at Lincoln Hospital, and they weren't necessarily sensitive to the culture of the Puerto Rican community in New York. And so, in
Mhm.
that space, she served as an educator and a liaison to kind of like bring two parties together to, make a better situation for
Oh,
patients.
that's awesome.
She also casually taught at Albert Einstein College of Medicine, Yeshiva University, Columbia, and Fordham at different times.
Wow.
Yeah, just casually with her four kids.
That's a real resume right
I
there.
know. And she's wild. So when she was in medical school in Puerto Rico, she realized that the US was using Puerto Rican women and men as sterilization targets and testing birth control technology on them. I know.
Oh, wow.
Yeah, so she joined as a founding member the Committee to End Sterilization Abuse and then also founded the Women Caucus of the American Public Health Association when she came back to the States.
Hell yeah.
She supported abortion rights, pushed to end sterilization, and worked to ensure that there was neonatal health education for underserved people. So we just love
It's
her.
so important,
Yeah,
yeah.
yeah. In 1979, she became a founding member of another committee, the Committee for Abortion Rights and Against Sterilization Abuse, and testified before the Department of Health, Education, and Welfare for passage of federal sterilization guidelines, which did come about with the addition of a waiting period between consent and sterilization. So I think we talked about before how California had their own law that passed based on that one court case.
Hmm.
And Helen was pushing to make federal law and like ensure that it was just national.
Wow. Yeah.
And if that wasn't impressive enough, in the 80s, she became the medical director of the New York State's AIDS Institute. She has touched the lives of so many when it comes to public health services for women and children. And then in the 90s, she served as the health co director of the Pacific Institute for Women's Health, a nonprofit research and advocacy group dedicated to improving women's well being worldwide and focused on reproduction. She was a founding member of both the Women's Caucus and the Hispanic Caucus of the American Public Health Association and the first Latina to serve as the president of the APHA.
Wow.
I know. And there's like a couple moments in her experiences where people ask her why
Hmm.
she focused on women, children, and reproduction. And she's always attributed that choice to her aunts and her mother, like her family members who have been through like difficult situations. So
Yeah.
she saw it and she was like, I want to make a difference in that space.
Wow.
I know.
That's incredible,
I know.
honestly.
I love her. She's a feminist that worked to ensure women's health was a focal point and improved. President Bill Clinton, love him. Don't cheat on your wife, but love him. Awarded her with the Presidential Citizens Medal in 2001 for her work on behalf of women, children, and people with AIDS. At that visit to the White House, her granddaughter is said to have given the president a handwritten letter asking for him to intervene because the Navy was bombing Puerto Rico. So she's passed on her advocacy and activism
Yeah.
to her granddaughter. And then Dr. Rodriguez Trias passed away later from cancer. So her legacy lives on in
With her
those
family,
with her
yeah.
family and those she's impacted.
And it sounds like she had like really an incredible life.
I mean, that's the kind of life you hear about and you are like aspire to.
Yeah,
live.
everyone should aspire
Yeah.
to.
And that's her, Dr. Helen Rodriguez Trias.
We love you.
Minisode.
Minisode. Baby one.
A baby one.
Follow us on Instagram, Twitter.
Yeah.
You know the plugs.
Yeah, follow us there. Hit us up for any other Minisode recommendations. Maybe you know somebody
Yeah.
who's inspired you maybe in this field.
Yeah, and if there's if we can also do a little plug, if you're listening on Apple Podcasts or Spotify or Stitcher, if you can like, subscribe, and review us, it helps us get to more people.
Yeah, appreciate that.
And we'll keep bringing you the hits.
Do 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 do.